Measles, a communicable disease. Video created by Aisha, Raymond, Lindsay, and Mai, Chico State nursing students. Infectious agents. The measles virus is caused by single-stranded envelope RNA virus with one serotype. It is classified as a member of the genus Morbillivirus in the Paramyxoviridae family. Prevalence. From January 2nd to May 21st, 2016, 19 people from 9 states reported to have measles. In 2014, the United States experienced a record number of measles cases, with 667 cases from 27 states reported. It is the greatest number of cases since measles elimination was documented in the United States in 2000. Key facts. In between 2001 to 2013, 37 to 220 cases reported yearly. In 2014, there were 114,900 measles deaths globally, about 314 deaths every day or 13 deaths every hour. During 2000 to 2014, measles vaccinations prevented an estimated 17.1 million deaths, making measles vaccine one of the best buy in public health.
Mode of transmission. The measles virus thrives in the mucous membranes of the throat and nose. When an infected person sneezes or coughs, the virus is expelled in droplet form into the air and can stay in the air for up to 2 hours. If someone breathes that infected air or touches infected surfaces and then touches their mouth, nose, or eyes, they can become infected if they are not immune. The measles virus is very contagious. 90% of non-immune people will contract the virus if they come into contact with someone who is infected. Host. Humans are the only known hosts susceptible to developing and transmitting the measles virus. Why should you be concerned? Due to misconceptions about vaccines, parents are choosing not to vaccinate their children. This puts them at risk for contracting the measles. This is more than just a fever and a rash. 25% of measles cases in the U.S. require hospitalization. 1 or 2 out of 1,000 in the U.S. will die from this. An infected person is contagious 4 days before the rash develops and 4 days after it subsides.
Incubation period. The incubation period of measles from exposure to prodrome averages 10 to 12 days. From exposure to rash, the onset averages 14 days. Symptoms. Measles symptoms often present 10 to 14 days after exposure to the virus. These symptoms consist of runny nose, sneezing, sore throat, hacking cough, swollen lymph nodes, fatigue, diarrhea, and high fevers ranging from 103 to 105 degrees Fahrenheit. Red sore eyes are also a factor. As these symptoms start to go away, Koplik spots present, which are clusters of white lesions on the buccal mucosa of the mouth, followed by the classic red rash that presents all over the body. Diagnosis. Measles is often diagnosed by an exam from a physician or care provider by using characteristic symptoms of the virus, such as the white spots in the mouth or the full body rash, accompanied by other symptoms. Viral cultures or lab serology can also be used to confirm the presence of the virus.
Treatment. Children should be kept isolated away from public schools for 4 days after the rash occurs. In hospitals, respiratory isolation through the 4th day limits chances of exposure to others. Although there is no treatment for measles, the complications should be appropriately managed. Vitamin A depletes, especially in malnourished children, which further weakens their immunity. Vitamin A supplements, if started at the time of diagnosis, replaces the body's reserve, prevents blindness due to corneal ulcerations and keratomalacia, and reduces measles fatality. Methods of control. Measles vaccine. This is usually given in a 2-dose series. The first one is given in between 12 and 15 months of age. The second dose is given somewhere in between 4 and 6 years of age. The efficacy is approximately 95%. The duration of immunity is lifelong. The measles vaccination should be administered in combination with mumps and rubella, otherwise known as the MMR vaccine. This vaccination is composed of a live virus. It is prepared in chick embryo fibroblast tissue. MMR are supplied in vials as a freeze-dried powder and are reconstituted with a sterile preservative in order to be injected. The vaccines contain a small amount of human albumin, neomycin, sorbitol, and gelatin. MMR vaccine indications. These are indicated for children 12 months or older and susceptible adolescents and adults without documentation of previous immunity.